The Minister of Finance, Planning and Economic Development indicated on Friday that Minister of Health had returned money to Treasury after failing to utilize it.
So I said, Mama, we should have given us your plan. If you had given us your plan, then they will to provide that you remain the money. Now the money definitely has to go back.
However, during the same period, National Medical Stores was stuck with personal protective equipment that it could not distribute even as there was an outcry about the shortage of the vital protective gear needed by COVID-19 frontline workers.
We are warehousing and distributing upon their instructions. They must give us written orders on what we are going to distribute where.
The Minister of Health rebuffed the concerns on grounds that he did not have a budget for the distribution.
The cost of transporting this PP was not available in the budget, but there are already existing mechanisms. These items are not so bulky. They can be transported along other essential medicines.
The Association of Medical Workers and National Organization for Trade Unions have demanded immediate prioritization of the management of health workers.
We now have no hope because oxygen is finished, PPEs are not there. So we are just demanding that the government puts in place a system to manage health workers who fall sick.
They were taken aback by the revelations pertaining to the availability of the PPEs in the country at a time when several medical personnel have succumbed to the pandemic in the line of duty.
Asking our members of parliament to do something about that. Let them rein on these people because they are accountable to the people. When people are dying, the workers are dying, and yet the money is not given for transporting. It's not acceptable.
The Minister of Finance is telling us has 3,500 billions not spent. And yet people are dying. What is it going to be spent on? It's Ugandans first, the rest can come later.
The workers' representatives have advised government to establish oxygen plants to distribute oxygen to both private and government facilities, partly to mitigate the shortage, as well as cut on the astronomical fees charged in hospitals. Jackson Onyango, NTV.